Okay. Just lately, we have been devastated by the numbers of deaths due to the fentanyl crisis here in Calgary, more than any other health region in Alberta. Tell us a little bit about our plans as a health region and moving forward.
This is an unbelievable crisis.
Yeah.
And many of us don't understand what a big deal this is. We lost more people in Calgary last year to opioid overdoses than we lost to homicide and car collisions combined. We lost 150 people in Calgary, 3 people a week. And this stuff is so dangerous. It's so dangerous. Because what's happening is that people have these pill presses and they're making this in their house. But imagine making chocolate chip cookies. When you make chocolate chip cookies, you cannot make sure the same number of chocolate chips is in each cookie. It's impossible. Same thing when you're mixing fentanyl. The problem is fentanyl is so potent that it could be a situation where 1 grain makes you high and 3 grains kills you. And you think about this, now people are using this thing called Carfentanil. It's an elephant tranquilizer. How desperate do you have to be in your life that you'd be willing to put an elephant tranquilizer in your body? So this is a big, big problem. And I used to say we're losing 3 kids a week, but they're not kids. They're of every age, of every income level, unlike in Vancouver, where a lot of the overdose deaths happen downtown on the street. In Calgary, the overdoses, 80% of them are happening outside of the downtown core. People are overdosing at home.
Absolutely.
And so it is incredibly widespread. So what do we do? Well, I think we got to work in a number of ways. Number one is we got to keep people from dying. You know, this is a crisis and we got to do that. That means we got to have a very serious conversation about the next generation of safe consumption sites where we can make sure people are not overdosing. We got to make sure that our first responders have access to Narcan or naloxone, and I was happy to see some of the legislative changes on that because it does work, but by the way, it also emboldens the addicts because now they think they're not going to die because they've got the Narcan. So we got to play these things out. So we got to help people not die. We got to help them get better. And that means we have to focus a heck of a lot more on mental health, on treatment. And I've been said to the federal government that we in Calgary are willing to be a test bed for any new modalities of treatment, whether it involves prescribing substitutes to heroin. I've learned so much about a world I never thought I'd know anything about. And bringing people through treatment programs. So we're going to see some real fast change really quickly on that. And then we have to work on prevention. You know, we have the highest in Alberta, we have the highest rate of opiate prescriptions in the country. We got to get out to the medical community, talk about alternatives to get people off of this in the first place.
Okay, and that is happening, those conversations are happening on a national and a municipal level?
You know, they're happening on a national level. I sit on a task force that's chaired by the mayor of Vancouver, where, by the way, they've had 1,000 fentanyl deaths. And he's working, and we're working with the federal government and all the provincial governments. But I'm also very impatient because people are dying. And so in addition to these national policy conversations, I keep saying, we'll be the lab, we'll be the test bed, we'll be the pilot projects. You want to start stuff next week, we'll start it next week in Calgary. And I'm hoping that we'll be able to keep moving forward on that as well.
Okay, great. We'll look for more updates on that during our next conversation when we have you in studio.